I haven't really shot a long video for a while in horizontal format. You know, the trend now is very short videos, but I want to talk about this filler backlash right now where people are really opposed to fillers because of all the complications they're seeing, long-term, short-term, everything. I think it's been a wave on the internet, on social media, specifically with I don't even follow it. My wife is the one telling me some of this stuff, like Kylie Jenner or all these people that are having ridiculous looking results. And I want to address with you, having done fillers now for 22 years and having a perspective as both a surgeon and an injector. I continue to do all my own injections myself. And of course I do facelifts and rhinoplasty and blepharoplasty. So I have a very unusual position, which is one is to have done this for so long and also to have done both procedures so that I have a very clear insight to the complications I've seen with my patients, the problems long-term and the problems I haven't seen and why. So I want to address with you that I think fillers, and you've heard me say this is not a new video about this subject, fillers are permanent. Even fillers like Restylane, Juvederm, things like that. Of course, there's a component that does subside and then goes down, but there's a component that really lingers and stays for years. I had a patient from New York, I mentioned this also in a previous video, at 15 years who had an MRI that showed the fillers I put in there were still there. In fact, I just saw her because she had moved back to Texas. But she's still looking amazing and with really no complications. In fact, I think the reason she looks so young is because the fillers I put in her 15 years ago have still held very well. So that is something that I want you to understand. There's some really amazing long-term effects of fillers, and there's obviously some really bad issues with fillers. So let's talk a little bit more about what is this permanence and what does that mean. So I don't think if you do one round of fillers, it's permanent. I think that when you do fillers, you get a result that looks pretty good and then it subsides and then you redo it. The problem is I find that a lot of patients, they forget what they used to look like, where they have this mentality, it's due for fillers. It's been a year, it's been 2 years. I better hurry up because technically on the pamphlet or what the doctor told me or the injector told me is that it's going to be gone in 6 to 12 months. This is absolutely false. There is a component that lingers. So I want to talk a little bit about granulomatous issues. I want to talk a little bit about migration potentials. And those are the things that people are really scared about long-term with fillers. And I want to sort of walk you through what I've observed and what things I haven't done anymore and what things I've continued to do and why. So migration that people talk about right now is in the lips. And I will say that I've done fillers now for 20 years. I have yet to see a issue with migration in the lips. I think there are several reasons for that. One is I don't put it in the border. So if you think about what migration potential is, it means that it's going from here to here. And that's not the case. I have never seen that. Now, of course, you know, next week I could have a patient comes in after 20 years and there was a migration issue. But I've been doing fillers since Restylane, so hyaluronic acid since 2004. So, and now it's 20 years out. So I think in 20 years, you have a pretty good time frame of seeing where things are. And I'm talking about thousands, if not tens of thousands of injections of patients. So a conservative injection that's well designed is really, really good. If you place it into the border, I think through migration, that can migrate farther up. That's why I hate doing borders. I've never done borders in 20 years, and that's probably the reason why I haven't seen the migration issue. Again, I could see a migration issue show up, but that is a major thing that I want you to understand is that the migration, I think, is that it's in an area that's highly mobile in terms of movement, and it can continue to ride upwards, and that can be a problem. And it's also already artificial looking, and so I don't like borders. And when you put borders, it continues to migrate up, and then it can be problematic. So that's an issue. So I haven't seen that. And plus, the other reason I don't think I'm seeing migration issues in lips is that I don't listen to my patients. In fact, I had a patient just last year that was referred by someone else that said, she came in for fat grafting, and I had mentioned that I said it in a very kind way, as kind as you can say it, because I have a fiduciary responsibility to say something, is that her lips look a little bit artificial. She hated to hear that, got up and left, didn't want to hear anything about it. So I want you to understand is that I don't design lips that look weird. I hate it. And so I don't listen to my patients. If a patient says I want more of something fake, I'm not going to do it. And if a patient wants something in terms of they think, hey, I'm due for it, I just tell them no, you don't need it. And if they beg me and and harass me, I'm not going to do it. And so I think my patients have been with me long enough, really know my philosophy. So I'm an artist. I paint portraits. I paint flowers and plants. I paint abstracts. So I'm really focused on good work and design. So I will tell you that I just don't design it badly. And so that's one component of migration. Now, I have seen in my patients, unfortunately, migration issues under the eyes. I have stopped doing fillers under the eyes for the last few years because I've unfortunately seen 5 years out, 7 years out, the filler that's under the eye due to the bicularis motion, migration potential. And it's hard to dissolve, which is another subject we're going to talk a little about dissolving it. And we'll talk about issues of what brands are probably better. And I don't have financial affiliation with companies. So unfortunately, this is just an honest appraisal of where things are. But so under the eyes, migration. Around the lips, if you're tooting in the border, probably migration, simply because I think that it's an area that's not good, but in my hands, I don't see it. So that's another thing to understand. Let's talk a little bit about granulomatous issues, which are long-term infection issues. I have seen issues with Belafil, formerly Artifil. I have seen issues with Juvederm products that are second, third generation, anything with a Voluma, Volure. Very rare chances of this stuff, but it is unfortunately possible. And so those are things that you need to understand are risks. So I try to stay away from those brands. I threw $100,000 of Belafil in the trash because of the issues I've seen long-term with it, where I've actually had to cut out areas. I had a gentleman from the West Coast recently. I took out almost fist size off his face. Very difficult surgery to correct that. And I've done, unfortunately, quite a few of that, and some in my own patients. So something that I can correct with very, very good results, with very little scarring, very safe because I'm a surgeon. So again, that hybrid of being a really good injector and a really good surgeon helps me, I think, minimize issues. But I haven't really seen migrations elsewhere outside of the eyes and the mouth area, as far as I can see. And I've done, again, thousands of 10,000. I've seen patients where I don't see them for 5 years. They come back and they go, Dr. Lam, ready for some stuff, and they still look really, really good. So that's something you understand. Now, I just saw a patient recently who had overdone cheeks by someone else, and I don't put in the cheeks. It's a whole nother video. But she had lost all this weight, so the outer portion looked odd. So she already looked fake with the cheeks, but she didn't like how it looked fake on the outside because now the cheeks really stood out. So that's a risk. As you age around the fillers, you may need some touch-ups to blend it in. But that's true for fat grafting. That's true for almost any kind of volumization. So, the issue is really most fillers are incredibly safe long-term, but these are some of the risk factors. We're going to talk about dissolving now. So the problem with dissolving is that it's not easy to dissolve these fillers, and you can easily over-dissolve. So what does over-dissolving mean? So when you dissolve, so hyaluronic acid is a constituent element in your skin. So when you dissolve, you could dissolve both the filler and the hyaluronic acid. So what I do is not a perfect recipe, but I'm very gentle. And what I do is I use a cannula dissolve. I use a ultrasound guidance so that I can actually see where the filler is. I use a dilution, depending on how fast I want this to dissolve, or if I'm going to go back and add fat anyways, then they're not going to see that issue. If I'm going to do a fat graft over this area, I will dissolve the fillers a little bit more rapidly. If I'm trying to avoid a fat graft, I will try to do it more gently. But I always warn patients, number one, I may not get rid of it all because it's hard to dissolve completely, especially when you're dealing with some of the Voluma, any of those V ones, or sometimes it can take 15, 20 times to dissolve it. And I because I'm gentle with a dilution and with a target guidance, I want to avoid an over-dissolve. But I also warn that they could be over-dissolved, and over-dissolving means one of two things. One is that if your natural tissues have dissolved, over time they come back over 3, 6, 9 months. No one wants to hear that, but that is an issue. And the second thing, I could just dissolve your fillers back to where your baseline is, in which case you probably need a fat graft. Now, I'll make a quick aside. As you probably know, I do a ton of fat grafting, very passionate about fat grafting, a lot of limitations and issues with fat grafting too, which I'm not going to talk about in this video. But the one thing I will tell you that it's hard to convert a filler to a fat grafting patient, because with fillers, despite some of the long-term issues with them, I have seen that the results are really near perfect, whereas fat grafting is not near perfect in terms of perfection, but they look so much younger, they just don't remember what they used to look like until I show you the photos, that it's a hard mental conversion, because when you're thinking of fat, you think, well, it's permanent, what I told you fillers are, but you also start thinking, well, fat is going to be just like a filler, and it isn't. It's a graft. It has to have blood supply to survive. That's why technique is so important to get good results. But that's another whole subject, but I just want you to understand even the conversion of filler to fat is a whole different discussion, and I try to weigh all those things for my patients. The final topic I want to talk to you about, because I'm a surgeon, I want to talk to you about it from a surgeon's perspective of doing facelifts in the setting of fillers. What are fillers that I don't like seeing? What are fillers that I really don't do anymore, and why I don't do them? Probably one of my most popular videos on YouTube is why I don't use Sculptra, and it was in 2023. I think I've had close to 100,000 views on that. And one of the things I didn't talk about in that video, you're welcome to watch that video more in detail, why I don't use Sculptra. The summary is that it's unpredictable. I think it doesn't give me the volumization I want in a predictable way. Sometimes you get good results, and also because I have just better skin technology in terms of mesobotox, which is another video you can watch about how I target the skin. But what I want to focus on in this situation is a issue of scar tissue formation and elevation of planes of tissue with a facelift. So I do a deep plane facelift where I'm going below the SMAS layer. I have found, yes, scarring with fillers, all fillers create scar tissue, create a little bit of plane that's harder to dissect through. Even previous facelifts sometimes, if it's a facelift that's done well with a deep plane, it can make the tissues a little bit harder to work with. But the ones that I've found to have a lot of scarring in the planes that make it particularly more difficult are Sculptra and Radiesse, and also Bellafill. Those are ones that are like rocks. They're like cement is probably a better word to cut through, and it makes things difficult. And I think a little bit higher risk, not risk if you have a really careful surgeon. I'm doing very short flap dissections now. The concept is preservation facelift. Again, that's a whole nother discussion. Unfortunately, each discussion I'm giving you launches into a potentially 30-minute video alone, but I'm not going to go into it. The short summary is a preservation facelift is a very short skin flap, so it helps protect everything. It doesn't mean you're not dissecting, though. You're still having to dissect through difficult planes. So Radiesse and Sculptra are not bad products. This is not meant to poo-poo a product, but it's also to mention the things that I've clinically done that I've had problems with and things that I encounter when I'm doing a surgical procedure. So this video could be a lot longer. I've tried to keep it as concise as possible. I focused on the difficulty of dissolving some fillers. I've focused on where migration issues are and why, what brands I think potentially have been problematic, how to address granulomatous issues or issues through excision or through other methods, and issues of confounding treatments with a facelift. I want to suffice it to say, I think fillers are still incredibly safe in the right hands. And, I had a lady about maybe 5 years ago that said, I'm not seeing Dr. Lamb anymore. I found a place that charges $100 less for a filler. And I want you to understand that that is such a ludicrous comment, because now that we understand that fillers are not like a temporary fix, that it's going to be there for 3 months, try it on, see if you like it, because they're difficult to dissolve, because these results potentially could be lifelong and hard to correct, you really want to go to someone that knows what they're doing. And as I said, I'm not a perfect injector. I've had complications, issues that are not perfect that I've had to fix on my own patients. But I've learned from those and I've continued to modify, and that's what has led me to this video now at the close of 2024. But I want you to understand you need to find a qualified injector, and that doesn't even fit, that doesn't even mention right now what I just saw this on a post online where there were people that were dying from illegal Botox. There's a med spa that injected thousands of illegal filler that imported from overseas. Yeah, my God, I don't know what they're injecting into the face. Could be cement, adulterated products that you can't get out. Not easy to correct these problems. I've sort of made my practice on cutting out silicone from lips and having issues with granulomatous changes that I've got to correct. Now, I still believe silicone's a great product for acne scars. I use it in very limited ways to micro-correct rhinoplasties, acne scars. I've had really a high and tremendous safety record with lips. Not a good place for silicone. And especially the problem is most people doing silicone are ones that are unlicensed. They're probably not even using a good product. They're not doing it in a correct way, and they're putting it in a place that shouldn't be put. And when you see these illegal things, when you're trying to go cheap on fillers, my God, the last thing I also saw, I heard that was even on Amazon you could buy, which fortunately some of my colleagues have helped shut down. So dangerous, so absolutely dangerous that this is your life, this is your safety issues. And I would encourage you that either don't do fillers or get fillers in a conservative fashion by a qualified injector who's done it for a long, long time, that understands the safety profile, understands where to inject and where not to inject.